Good morning. I thought that uh, I would talk about the true definition of health today. This is a really interesting one. We actually do a health talk every fortnight in the clinic when we were running as per usual. And this is one of the things that I highlight the whole discussion around because essentially this topic is essentially how we really should be focusing on health as opposed to what the medical model sometimes does. Now, interestingly enough, it is the World Health Organization, which is a medical model that sets this definition. And I feel like it's really important that we actually understand what the definition of health is given to us by the World Health Organization, because then we can actually start to work in a way where we can work towards that. And so the World Health Organization defines health as the following, which is complete physical, mental, and social well-being, and not the absence of disease. And ironically, the only time that medicine or the medical model or the health service actually considers taking care of someone is when someone is got symptoms, which is interesting because if you look at the model or the description of what they're recommending for health, which is complete physical, mental well-being and not the absence of disease, why are we waiting until there's disease to start managing people's health if it's actually a health service? And so it really makes us ask the question, what should we really be doing about this in order to actually improve and work on our health? Now, if you look at the three different arms, you've got physical, you've got mental, and you've got social. And you need to have a balance of all three in order to make sure that your health is going in the right direction. If we look at chiropractic works in a very similar way that when we're talking about health, we look at the physical, we look at the mental, and we also look at the chemical. So there's just one bit that the World Health Organization isn't looking at is chemical, but what we basically know, what we know about our health is that actually when we start to change our lifestyle physically, chemically, and emotionally, we can start to see improvements in the way that the body functions. Now, interestingly, I've spoken about this in some of the other videos, is that actually if we look at our diet and the way that our stomach is working, our colons or our stomach is actually producing serotonin, which is our feel-good hormone. So what we know is if we're imbalanced in any of these areas, it's not just going to affect one area of our life, it's actually going to affect all areas of our life, and as a result we can start to see that change in our health. So don't look at health in this way, which is an on-off switch, which is that medical model of looking at a problem and fixing it. Okay, it's a little bit like your car. If you wait until your car breaks down in order to service or maintain it, it's going to potentially be one of those issues where actually it gets to a point where it breaks so bad it physically is going to be impossible to either fix it, or it's going to be so expensive to fix it that it's not going to be worth fixing that car. And our body is the same way. If we're not taking care of our physical, our mental, and our social well-being, what's essentially going to happen is it's going to be like taxing the car. It's going to be wearing that down, and if we're not going to service or maintain that, can you imagine what that's going to start to do or create as issues for our health? And so I think it's really, really important that we don't necessarily as chiropractors just look at the physical thing. We start to actually manage into those other areas of our life, including our diet, including our mental well-being, setting ourselves a positive mindset, setting ourselves physical exercise, setting ourselves a decent diet routine so that we can actually be the best versions of ourselves and we can actually jump along that scale. And it's a scale. So in order to be physically healthy, socially healthy, and mentally healthy, you're not going to be mentally healthy and physically healthy and socially healthy all the time. So you're going to slide up and down that scale. But what we really want to be doing is sliding away from dis-ease, which is where we put too much strain and stress on our body, and towards ease, which is optimum function and ideal health. You're always going to be somewhere in between. Doesn't matter whether you're the most athletic and healthy eating, top sleeper, you generally look after your mental health. There are always going to be down days, and it's not about those down days, it's about coming back from those down days. So guys, here's the summary. Here's the summary. It's complete physical, mental and social well-being, not the absence of disease. So guys, don't wait until your body breaks down in order to take care of it. Super, super, super important in order to be able to take care of yourself early on. If you need education, there is so much content on our YouTube channel. There's so much content on our Facebook channel. We're here to help you, assist you. Look, we talk about proper hydration. We talk about proper sleep. You can listen to our podcast. There's tons of information that will teach you this stuff, or equally you can easily reach out to us. Our phone lines are open, and we'll be happy to have the conversations with you, and if there's no one available at that time, we'll organize someone to call you back. Guys, have a beautiful day. Hopefully the sun will come back out again this afternoon, and we'll have another one of those glorious 25 degree plus days. Enjoy the sun. Take care.